Now, in terms of our current understanding for the role of the arms, and as they swing during walking, there comes this question of what is the functional significance? And if we want to think about the functional significance, we think about the mechanics and the energetics. And really, it's thinking about, do they provide benefits? We've shown that arm swing, when the arms are allowed to swing, it provides clear metabolic benefits, especially at optimal speeds and above, provides mechanical benefits. So it helps reduce those peak free vertical moments that we generate along the ground. And it also helps to minimize the amount of energy that's required to walk. Now, this inspired us in my lab to think about, well, what if the arms could play a more active role during the walk? By that, we said, well, instead of allowing physical therapists, right, drive or provide some external assistance, what would happen if we gave control, right, to the patient themselves? We have our Vertec treadmill, okay, split belt. We have our markers. We had some EMG sensors. And then we had a couple of load cells here at the wrist to rope connection, which can allow us to measure the force. And then here's our simple rope-pulley design here. So we found a dramatic increase in the triceps activity and the biceps activity, while at the same time finding a decrease in the activity of these two lower limb muscles, right? The medial gastrocnemius muscle and the soleus, which we know are two key muscles that help with forward propulsion during walking. Now, what do we find in terms of metabolic energy? Okay. On average, we found a 17% decrease in the energy that's required to walk. Though we required more or greater muscle activity in the upper limbs, this was offset by the lower demand placed on the legs, the lower mechanical demand placed on the legs. So what does this mean for future work? Well, one of the ideas that we have is, or really to try to address the question, could this work in a clinical setting, right? In a rehabilitation setting? And trying to help patients who are trying to recover from a spinal cord injury. We think that if we can build the right system and gear it in a very simple way, this might be able to help patients, right? And thinking about a patient as playing a more active role in their own gait retraining. So key takeaways for this talk, right? We've shown that arm swing provides both mechanical and metabolic benefits. Also shown that arm swing is crucial for helping minimize energy costs. And the questions that remain really is to understand whether arm swing can play a more active role, right, in a gait rehabilitation setting.